Good evening, everybody. Please be seated. Please be comfortable. We'll have a wonderful 1 hour coming up. This will be second Ashok Pangadia Memorial Quiz. Actually, this is the fourth quiz in this series. But last quiz was first Ashok Pangadia Memorial Quiz, and this is the second one. Ashok Pangadia, those who have met him, he still lives with us. So whatever he taught, we use every day. May I request Dr. Arun Garg, who is the chief organizer of this conference, to come up and give his welcome note. Dr. Arun Garg, please.
Good evening. Good evening, esteemed colleagues, young neurologists, and neurosurgeons. It is with great pleasure and pride I welcome you all to this meticulously crafted quiz contest, an event that stands off as an emotional as well as intellectually stimulating tribute to my mentor and my hero, Dr. Ashok Pangadia. And I hope this quiz contest is thoughtfully designed by my friend Rishikesh Kumar, a distinguished alumnus of my alma mater, SMS Medical College. And it represents not only a competition, but a celebration of knowledge. And I hope then when this experience leaves us with lasting hangover of knowledge that stays with us forever. With this, I invite another cherished alumnus of my alma mater, Bhavna Sharma, to pay a pictorial tribute to Dr. Ashok Pangadia.
Good evening, ladies and gentlemen. It's my pleasure and privilege to be here to speak few words about my guru, who was my mentor, and I think whatever vision I could get in my life is because of following of Sir's path. Many of you might know Dr. Pangadia, many might not know, but I think in next 2 minutes, which I think is very less, if I start speaking about Sir, whom I was associated for last 26 years, but I'll try to do justice in 2 minutes. So, today, we are remembering a legend who lives eternally with us. Lord Hanumana. Sir used to worship Lord Hanumana always. And that is why I'm starting my presentation with this pictorial and with this shloka. Guru Govind dono khade, kaake lagu paye, balihari Guru aapne, Govind diyo bataye. This was a poem when Sir left for his heavenly abode. One of the consultants at SMS wrote this poem for Sir. दुनिया में नाम था, अद्भुत काम था, एक नेक इंसान, रोगियों के भगवान, कोरोना द्वारा चले गए, वो चले गए. सतत कार्यशील, व्यवहार में कुशल, पिता तुल्य, मार्गदर्शक. Each and every word means a lot to us because those who know him know that each and every word is correct. ज्ञानी, कर्मवीर, आकर्षक, जाने कहाँ इस असुर द्वारा पकड़े गए, वो चले गए. छोटे से गांव से उठकर पूरी दुनिया में नाम कमाया. SMS को बुलंदियां दी. RUHS, दिस इज राजस्थान यूनिवर्सिटी ऑफ हेल्थ साइंसेज, वेयर सर वाज फर्स्ट वाइस चांसलर, को बनाया. सुरक्षा घेरे से कैसे निकल गए, वो चले गए. जाने कितनों के अरमान थे, कुछ के लिए आसमान थे. सूरज थे, प्रकाशित करते थे सभी को, पता नहीं कैसे बादलों से ढक गए, वो चले गए. विश्वास ही नहीं होता कि वो नहीं है, एहसास होता है कि वो यहीं कहीं है. पर सच तो ये है कि बालू के कण हमारे हाथ से फिसल गए, वो चले गए. एक नेक इंसान, रोगियों के भगवान, कोरोना द्वारा चले गए, वो चले गए. दिस इज अ शॉर्ट वीडियो डाउन द मेमोरी लेन्स and few pics, I think, which I saved.
ऐसा ही सुख मेरे मन को मिला है, मैं जब से शरण तेरी आया मेरा। सूरज की गर्मी से जलते
Sir's family.
हुए तन को मिल जाए सरवर की छाया।
This is Pangadia.
भटका हुआ मेरा मन था, कोई मिलना रहा था सहारा। भटका हुआ मेरा मन
He was a singer
था,
also.
कोई मिलना रहा था सहारा। लहरों से लड़ती हुई नाव को, लहरों से लड़ती
All his students.
हुई नाव को जैसे मिलना रहा हो किनारा, मिलना रहा हो किनारा।
रहे न रहे हम महका करेंगे, बन के कली बन के सबा बागे वफा में। रहे न रहे हम महका करेंगे, बन के कली बन के सबा बागे वफा में। रहे न रहे हम। मौसम
This is when I became HOD neurology. I paid tribute.
रंग बन के
And this is finally his ashes got dispersed in Pushkar Sarovar. कुछ लोग दुनिया से चले जाते हैं, कहा जाता है कि उनकी कमी पूरी हो जाती है, बट सर वाज वन पर्सन, मुझे नहीं लगता कि उनकी कमी को कोई भी पूरा कर सकता है। एंड ऑल ऑफ द SMS alumni and all his students, I think, would agree with me. With this, I conclude my 2 minutes presentation. Thank you so much.
May I request my colleague Rupa, Dr. Nupur. All right, we can put it on. Let's start, right? Madam, please. हाँ, left लगा दें. माइक का क्या है? एक माइक है ना? चल रहा है. ठीक है. May I request the participants to come over to the stage, and can I have the name of participants here? I'll tell you the names. Shyam Dwivedi and Devrata Sahu. यहाँ पे अच्छा ठीक है. You are the JS Chopra team, so please come over. S. Siddharth. ठीक है. And Sampant Dash. You are in Dr. B. Ramamurthy team. Aparna Amarnath and Priya Narwal. NH Wadia team. Thank you. And finally, Shiny Joy and Julius Hemant. You're in Jacob Chandi team. For convenience, I can do team 1, 2, 3, 4 or ABCD, but remember the name of the team. All settled? Please come over, please come over. With me, I have my colleagues, Dr. Rupa.
Hello, good evening, and welcome to this exciting round of the Star Wars quiz. And as co-quiz masters with Dr. Rishi, we are very much excited to take this forward with you.
And Dr. Nupur.
Hi, I'm looking forward to this great experience with both of them. All the best to the teams.
And any fight if happens, madam is there. Madam is our arbiter. All right, so we'll move on. When we started this concept, we gave the name Star Wars, which was taken from the West, but we thought that this is not fair. We should come to Desi Star Wars. Can I have sound, please? And this time we'll have proper Desi Star Wars. And you can see that how they will go. There's one rule for this quiz for all participants, and only one rule I can tell you: no argument. Quiz master is the boss today. You know what happens that Rupa is boss every day at home, at work. But I get once in 2 years to become boss, and I like this days. Thank you, Dr. Arun Garg. All right, so rounds will be oral and visual round. I'll tell you the scoring at the time, rapid fire round, and some buzzer and Armageddon. Armageddon is sudden death. The first round starts with oral and visual round. Each question has 20 marks, right? And you don't have to jump in. This is not buzzer, so we'll give one by one, okay? First question to team 1 and second to team 2 likewise. And there's no negative marking. Marks is 20 for getting a correct answer, and no negative marking. But first response we'll take, no second response. And we have less time, hardly 50 minutes. To be very fast, we won't wait for more than 5 to 10 seconds time. It won't pass. Otherwise, time will be lost. Are you ready, team A or team 1? All right. Make it fast-paced. Turnaround time is no more than 10 seconds. We won't repeat the question. Round 1. You know, this is a very easy round, but I always like to be rooted to not to forget our neurological forefathers. So this is for you. Quick question. Founder of NIMHANS, pioneer of lesional surgery, name. You have to know that. Founder of NIMHANS, pioneer of lesional surgery. Wrong. The answer is Ram Murthy. That's wrong. This is Professor Ravi Martanda Verma, RM Verma. You have to know that, I can tell you. And that's why I'm telling you that it's very important to know. Mic's upon. All right. So that's very important to know. A surprise, yeah. Anyway, so this is to team 2, team B. He is considered as the first neurosurgeon of the country, founded first neurology and neurosurgery department. He is with Indira Gandhi, as you know.
Jacob Chandy.
Oh, great. Professor Jacob Chandy. So 20 marks to team B. And you keep the name, right? Okay. Team C or team 3. Identify the man. He was known as Papa Neuron, established neurology at CMC and AIMS. So he was the first neurologist of the country, you can say.
Baldev Singh.
Wonderful. 20 marks. This last question goes to team D. The neurosurgeon who established Institute of Neurology in Madras. Do I need to say anything else? Honorary Brigadier of the Army. He is a Brigadier of the Army. So Chennai, neurosurgery. Team D, team 4. B pass. B Ram. What is team, by the way? Right. So this is B Ramurthy. So we had 20. Scorer, can you raise your hand? You both are scorers, right? Perfect. So now audience question, quick audience question. Name. NH Wadia taking the rounds. Perfect. Lucknow. Okay, wow, great. That's great. Name. Only medical professional who received Bharat Ratna. B.C. Rao, Bidhan Chandra Roy. Wonderful. So we'll move on back to the teams again. Again, team 1. Are you ready? Team 1? Great. Now the real question. An X-linked condition with global development delay, Parkinsonism and dementia, name the sign and diagnosis. You get some sign, name the sign and diagnosis. Time starts now, 5 to 10 seconds. It won't pass, so.
Lubach's disease, X-linked Parkinsonism.
जोर से बोलो.
Lubach's disease, X-linked
Lubach's disease is wrong. This is Naegeli Halosign, B-PAN. When you go back to Naegeli, you can see Naegeli Halosign is very clear here. Question to team B. Early onset dysmorphic feature, organomegaly and dystonia. Name the sign and diagnosis. You can see the arrow is there. organomegaly dystonia early onset. MRI is very characteristic of
Niemann-Pick disease.
That's wrong. Can't you see a fork there? Can you see a fork there? That's wishbone sign and GM1 gangliosidosis. Okay, you could see there. So team 3, team C. Ready? Great. Subacute ataxia and diplopia. What is the diagnosis? You can see the appearance in pons is very characteristic of that.
Clippers.
Excellent. 20 marks. Clippers. Excellent. 20 marks. Team D. A case of Parkinson disease. See the video and name the phenomenon. He is doing this whole night.
वो अच्छे से दिख रहा है ना वो कब से
He's trying
5 घंटे से मेरी जान
Wife is saying 5 घंटे से कर रहा है. For 5 years he is doing, setting his bed. For team D, team 4. Speak up something. There's no negative marking. Sorry?
Dyskinesia.
Unfortunately, no, this is a very classical punting. This compulsive performance of repetitive mechanical task, doing and this is for punting. So that was my 2 rounds. Then I'll request Rupa to come over. And when Rupa comes, khamosh, because she is lady of words. In fact, these geneticist people, they use so many FGF, ATP7 that I feel like I'm in the matrix, right? I feel like that words are moving around, and all the diagnosis what you used to do, Haliburton-Sparks disease or whatever, it came to various letters. So, Rupa, all yours.
Thank you, sir. And this is not the time for khamoshi. So let us get back to team 1. So here's your question, team 1. Can you identify the mark structure on this histopathological slide?
Negri body.
Sorry,
Negri
can you
body.
louder?
Negri body.
Negri body, very good, correct. This is a very typical Negri body, which are classic histopathological features of rabies and very sharply delineated eosinophilic inclusions. Next question to team B. 20 marks. 20 marks to team 1. Yeah. Next question to team B. Team 2. What is your diagnosis?
Sea blue histiocytes.
I am sorry, that's not the correct answer. So these are vacuolated giant cells, which are non-Gaucher storage cells, which are seen in Niemann-Pick. Niemann-Pick C. Gaucher is sea blue histiocytes are seen in Gaucher disease, where you have a crumpled cytoplasm. You won't see these vacuolated cells.
Ma'am, actually,
So
sea blue
maybe we can
histiocytes
send
are
it to
seen
the-
in.
These are not. Okay. So the diagnosis was NPC. Do you want to send it to the artist?
He was close, so I'll send to Arbiter. I think 20 marks. If Arbiter likes, you can give half marks.
Yeah, I think 10 marks.
10 marks, okay.
So 10 marks to him.
Question 3, next to team 3, the next question. Identify the pathological finding.
Ragged fibers.
Ragged red fibers is not the correct answer. 0 points to team 3. So these are rimmed vacuoles in muscle biopsy, which you would see in a variety of muscle diseases with the rimmed vacuoles. Some of them are listed here. Next question to team 4. Team 4 ready? So what is the possible diagnosis? Team 4?
Pass.
Pass. Team 4 passes. 0 points to team 4.
Give to audience if you can. Give to audience. We have 3 points for audience.
Audience. Yes, audience. Sorry? Not exactly a parking lot, but...
One last try.
Yes, very good.
Wonderful. So Neha
Wonderful.
gets prize.
This
Rishu,
is
take
ring
name.
fiber.
Neha gets prize. Wonderful.
Ring fibers seen in myotonic dystrophy. Okay, so we finish one round and then we come back to team 1. Team 1, here's your question. Identify this cognitive test.
Benton face recognition test.
Sorry?
Benton face recognition test.
Benton?
BFRS.
Yeah, this is not the Benton face recognition test. Unfortunately, 0 points to team 1. This is the Cambridge phase memory test, which is a test again for prosopagnosia. Next question to team 2. Team 2, This picture represents a commonly used cognitive assessment test. What cognitive function does it test for? It's a very nice cartoon.
This is the picture test assessing the function of the parietal lobe.
Not
Visuospatial.
really. Can you be a bit more specific?
The visuospatial dorsal
No,
stream
this is
pathway.
not a test of visuospatial function. Audience, any guesses? Yes? Thematic apperception, no. So this is the ice cream van story. Ice cream van story, which is used to assess cognitive social cognition or a second order theory of mind, specifically in social cognition. Okay, next question to team 3. Team 3, this is your question. This is an FDG PET scan of a 65-year-old male with dementia. Identify the radiological sign.
Cingulate island sign in DLBD.
Very good, excellent. 20 points to team 3. This is the cingulate island sign in DLBD.
Team 3.
So next is team 4. Here is your question, team 4. Can you identify this tract highlighted in this DTI image of a 23-year-old healthy volunteer?
Commissural fibers.
Can you be more specific? Which tract is this? Is it a commissural fiber? Or?
U fibers.
No, that's not a U fiber. What we are looking for, this is a recently described tract called the frontal ischian tract, which connects the supplementary motor cortex with the lateral superior frontal gyrus to the inferior frontal gyrus. So this is the frontal ischian tract. Okay, so we finish another round and come back to team 1. Team 1, here is your question. This is a 32-year-old lady from the Agarwal community who has seizures at an early age, delayed milestones, gait imbalance, and dystonia. What is your possible diagnosis?
SCAR 12. SCAR spinocerebellar ataxia 12.
Louder, louder.
SCAR 12.
SCAR 12. So the moment we see hear that Agarwal, it comes. But there are other diseases which are also common in the Agarwal community. 0 points to team 1.
This
no
is
points to
MLC.
team 1.
This is, sorry.
This is megalencephalic leukodystrophy with subcortical cyst, which is a leukodystrophy which is also common in this Agarwal community. 0 points to team 1.
एक बार pause कर लें. वो sound कम
Yeah.
ठीक, you can go ahead.
Okay, so 0 points to team 1. We go to team 2. Team 2, please look at the question carefully. This patient has a limb girdle muscular dystrophy syndrome. Dysphagia is a prominent symptom for him. Name the type of LGMD.
This is OPMD.
OPMD is not an LGMD. Wrong answer. 0 points to team 2. So this is so dysphagia is seen in transportinopathies, which is LGMD2, D2 or 1F, TNP03 mutations. Dysphagia can be there in up to 30%, which is not usually seen in other LGMD syndromes. Okay, so next question to team 3. Team 3, this is your question. This is an ethnic group in this particular region shown in the map has a special predilection for a variant of Parkinson's disease. Can you name the ethnic group and the type of PD?
LRRK.
Yes. And what is the ethnic group? Very good.
Ashkenazi Jews.
No, they don't look like Ashkenazi Jews, do they? So 10 points to team 3.
10 points.
10
because
points.
One aspect
Half,
was right.
half a mark, 10 points. So these are North African Berbers. North African Berbers, and the LARC2 mutation is has a founder effect in them. The LARC2 mutation G2019S probably arose in a Berber founder. And it's very prevalent. About 40% of PD patients in that community have this mutation. So they are North African Berbers. Team 4, here's the question for you. Please see the question carefully. Name the gene associated with cerebral small vessel vasculopathy with renal and hepatic failure.
This is the clue or what? What is this?
I don't know what that dinosaur is doing there.
This is wrong.
He's come to see the quiz.
He has come to see the quiz.
Yeah.
Yes.
Hearns.
Sorry?
Hearns syndrome.
Kern
syndrome,
No,
no.
sorry, that is a wrong answer. 0 points to team 4. This is a big clue there. You
This
know
is
what
clue. This
what
is
this?
clue. Look at that dinosaur.
Audience? Yes, this is a T-Rex and the gene is
Solvina.
TREX1. TREX1 associated with RVCLS. which
T-Rex is
the-
dinosaur, so Trex one.
That was a huge clue by your very generous quiz master who has put it there. Okay, so we have finished 3 rounds of
Yes, sir.
neurology for each team, and now I would hand over
So what happens in any team? One person performs, other enjoys. So this time the things will change. Neurosurgeon. Look at Amitabh Bachchan. He's having fun, and Dharmendra is driving. Yes. Slowly.
Okay, so okay, I hope the surgeons have not slept. So, how many surgeons are there in the audience? Can I just have a raise of hands? Oh, not bad. Okay, here we go. Team 1, your question comes here. Won 1949 Nobel Prize for developing the surgical procedure of lobotomy. You have to name this person.
You want to give clue or no?
Huh?
Do you want to give clue? No.
No.
She's tough actually. So they did lobotomy and also one very major procedure which we follow all the time. Yeah. No?
Okay, so the right answer is Antonio Igas Moniz also developed cerebral angiography. Okay, team B, are you ready? Your question is, this is a neurosurgeon who won Pulitzer Prize for the book Life of Sir William Osler. You have to name this neurosurgeon.
Clue? No clue.
Photo is the
Come
clue.
on, photo is not clue. Nobody sees that. I am in proper non-academic center, so I like to give clue. There is a disease on his name, which is endocrinal disease.
Sheehan.
Huh?
Sheehan.
Wrong. Cushing syndrome, man.
Wrong
Cushing
answer.
syndrome.
The answer is Harvey Cushing. 0 points. We go to team C. And your question is this. These neurosurgeons changed the face of which specialty of neurosurgery?
Microneurosurgery. Microneurosurgery first.
This is wrong. Audience should not speak, right? Yeah, go ahead.
Microneurosurgery.
Can you specify more?
Bypass surgery, vascular surgery.
No. Vascular surgery, cerebral vascular surgery. Should you give 20 or 10 points?
I think 10 points.
10 points.
I'm sorry.
Yeah.
Because this is aneurysm. We wanted to have
Yes,
clipping
yes,
of aneurysm because they all have
So-
proponent of clipping aneurysm. Can you name them,
Yes,
please?
yes, we should name them. Dr. 10 points to team C. This is Dr. Ghazi Yasargil, Dr. Robinson Gupta, Charles Drake, and Dr. Sano. Hirotoshi Sano, famous for developing the art of neurovascular surgery. Okay.
These are the guys, they still feel that clipping is better than coiling, and they prove that in their work.
Next question, team D. Okay, I think I would request you to keep your mobiles away. Your question is this. You have to name this neurosurgeon.
Clue or not?
Any clue?
Very relevant for this meeting.
Course. Professor Course.
Professor?
Course.
Kurst.
No, unfortunately we have to give 0. This is
Dr. Alim Louis Benabid, who developed DBS surgery. Okay, we come back to team A now. You ready? What is the radiological sign seen in this CT, and what is the name of this radiological sign?
So easy.
I request the audience to keep their murmurs at a lower decibel level.
White cerebellum.
Exactly, he's correct. White cerebellum sign. White cerebral sign or dense cerebellar sign or reversal sign seen in brain death. Team B, are you ready? Your question is, a 2-year-old kid presenting with a large head and these head movements. So you have to name this phenomenon and you have to tell the possible site of the lesion.
Phenomenon is titubation.
Phenomenon is?
Titubation.
Pardon?
Titubation.
He gave the word titubation and
Titubation.
diagnosis.
Okay, no.
There's a clear name for that. This
No,
won't
no.
work.
The answer is wrong.
This is head bobbing tremors.
Very good. Head bobbling.
The site of lesion is at the this aqueduct and fourth ventricle near the CP
Pardon?
angle. Near the aqueduct and the fourth ventricle CP
Okay, I
angle.
think we can give them 10.
So, the first answer came as that was wrong. So, but second answer was very close. So,
10.
10. Thank you. So that's bobblehead syndrome. Bobblehead doll syndrome, and the site is suprasellar or third ventricle region. Okay, commonly seen in suprasellar arachnoid cysts. Okay, team C. Your question is a young patient presents with signs of raised intracranial pressure. You have to name the condition as well as the mutation.
condition is easy, mutation is tough. At least 10 marks, fight for 10 marks.
Okay. So, anyone in the audience?
Neurocutaneous melanosis.
Yes.
Melanoma, yeah.
Yes.
So, neurocutaneous melanosis.
Neurocutaneous melanosis and RAS mutation. And I think team D now. Here's your question. A 24-year-old male presents with headache. What is the diagnosis? You have two sequences and the names of the sequences are also given there. Yes, team D, team 4.
Brainstem cavernoma.
Cavernoma is not the right answer.
Maybe tuberculoma, I think.
Pardon?
Brainstem tuberculoma.
What did he say?
Tuberculoma is saying, tuberculoma.
Okay, no, I think that's not the right answer. The answer is capillary telangiectasia. Okay, so we have one more question.
I think no, we are
It's the same name with this, I think.
For this, I'll ask arbiter because both similar, right? Should we give them up?
No, it's totally different. Yeah.
Fine. All right.
There's only one question. So I think.
D is done, right?
Yeah.
Okay, so one more round is there. Whole round is there.
Okay. Team A. Name the clinical sign demonstrated in the image and the clue is that it is used to test facial palsy. LMN facial palsy. Don't see there.
No.
This is tough. Anybody from...
Even neurologists can answer this.
Any from audience?
Yes, I think that's correct. Burgara-Wartenberg sign.
Wartenberg sign.
Yeah, team B, ready?
Team 2, yeah.
Name this device used in endovascular procedures.
It's very easy.
This is clot aspiration device.
What?
Clot aspiration device.
Clot aspiration device.
What is that?
Clot aspiration device, he's told.
This is used for this mechanical thrombectomy where we aspirate the clot. Clot aspiration.
I think he is saying clot aspiration.
I think fine.
It is close. Stint. Yeah, so 10 marks.
Okay.
What is the name? Particular name is there, not Trevor stent retriever.
Retriever stent. Okay, 10 marks, please.
10 marks. 10 marks.
Team C, your question. Name the artery pointed by the arrow in this angiogram film.
Very easy.
Brachiocephalic trunk.
Brachiocephalic, 20 marks.
Very good. Team D, ready? What is the structure pointed by the arrow in the MR venogram of the brain?
The strike sinus.
Very good.
Very good. So 20 marks. Well done. So that finishes this audio-visual round. Can you have score if you can? Or is it too tough to do that? Try to do that. Meanwhile, we'll bring out, we have second round is rapid fire round. Firing will be there, rapid firing will be there. So what you can do, one scorer can add and one scorer can follow this, right? What do you have? So this is being led by team 2, followed by 2 are on the tide. Sorry, team B Ramamurthy, na? No, sorry. I'm sorry. एक बार आवाज.
It is Team C leads with 0.100, followed by Team B with 50, Team A 40, and Team D 20.
So next round can make or break, right? Okay, as you can see, because this is rapid fire round, and 4 questions from neurology, 4 from neurosurgery to 1 team. Be ready. Means there are 8 questions. Means there's scope of 160 marks, you can imagine, right? So 20 marks for each, but 5 negative marks. And we cannot wait for a long time, so be ready and you will do well. Start from team 1.
Team 1, yes?
Yeah.
Okay, team 1, you ready for your rapid fire questions? There is negative
5
marking.
negative marking.
Yes.
Sir, what is the time?
There's no time. There's rapid fire, so there's no time. As soon as she finishes, you have to tell in 5 seconds.
Can we come back to the question?
No. No, you cannot come back to the
questions won't be repeated. So we'll go very slow in the question.
Yeah.
So it's clear, but questions won't be repeated.
So you either pass it or you give an answer. If it's correct, you get 20 points. If it's wrong, you get -5. Okay, so team 1, here's your first question from neurology. Name the antibody associated with phenylistic movements. Eglon 5, 20 points. Expand, Padmal. Pass, 0 points. It is pontine, autosomal dominant macroangiopathy and leukoencephalopathy. Name the drug associated with the clinical trial Boundless. Quick. Pass. It is phospholipodopa carbidopa infusion, subcutaneous infusion, 0 points. The neural connection between the deep branch of the ulnar nerve and median nerve is called?
Martin-Gruber anastomosis.
Sorry, wrong answer. -5. It is the Rishikanu. This is the deep branch of ulnar and median. So now I hand over to the neurosurgeon.
You ready? Your quick 4 questions. First question. Pronounced tone decay is seen in vestibular schwannoma. True or false?
True.
Correct. That's the right answer.
20 points.
20 points. Kegelhalton or paratonia is seen in impairment of which lobe of the brain?
Frontal lobe.
20 marks.
Right answer. Dexmedetomidine, a drug used in anesthesia for awake craniotomy, works on what receptor?
Alpha 2 receptor.
Alpha 2. Anything else you want to? Which receptor? Alpha 2?
Alpha 2.
Adrenergic receptor. Yeah, that's fine.
Anyway,
that's fine.
Alpha
Please.
2 he will get because
Yes, that's
alpha 2.
fine.
So 20 marks.
20 marks. Last question. A major clue to the presence of nuclear third nerve palsy is the weakness of which muscle in the opposite eye?
Superior rectus.
Very good. That's the right answer.
So they got
20 points.
20 marks. So 20 into 4, all. Wonderful. 80 marks. Wonderful. So team 2.
Okay, team 2, your rapid fire questions from neurology. First question. Name the antibody associated with Rasmussen's encephalitis.
MGLUR receptor.
Sorry?
MGLUR.
MGL2R.
Metabotropic glutamate receptor. MGLUR.
Something more?
1 and 5 both are there.
1 and 5, it is actually 3. I think we can give
Yeah, we can
10
give.
points. 20? 20.
20, okay, 20. Madam says 20 is 20.
20 points.
20.
Next question. Expand, LBSL. Rapid fire. Clock is
We can move on. Yeah.
Pass. Pass.
Leukoencephalopathy with raised this lactate level.
That's not the exact definition. I think we passed it. 0. No need
Yeah,
to give
okay.
negative.
All right.
0. It is leukoencephalopathy with brainstem and spinal cord involvement with lactate elevation. Okay, next. Name the drug associated with the clinical trial Engage. Engage. Pass.
Pass.
Okay, it's very, very famous drug and a very lot of controversies over it. Aducanumab. Engage and Emerge, where the 2 trials are tested. Aducanumab in Alzheimer's disease. Last neurology question to you. The botulinum neurotoxin with a duration of action of 6 months is?
Rimonabulal toxin.
Zimona. This is the new one, which is?
Can you say again?
Sir, Remo.
Rima botulinum. I
Rima,
think.
she is-
Rima,
is
no,
Rima.
this is daxibotulinum toxin. Daxibotulinum toxin. So 0 points.
Minus points.
Oh, -5. Sorry, -5.
-5, -5.
Okay, so no one's sleeping here. That's good to know. Okay, so first of all, I'd like to tell that these all participants have come after a very rigorous initial preliminary round, which was done yesterday. So I think first of all, we need to appreciate that. So all the best to all of you. Your rapid fire neurosurgery round, team B starts here. First question, otic ganglion is a parasympathetic ganglion located below foramen rotundum. True or false?
False.
Good, right answer.
20.
20. Next question, recommended dose for 50% isodose in vestibular schwannoma and gamma knife radiosurgery is?
Pass.
12 to 13 grays is the right answer. Next question, the filter used to visualize ALA-induced fluorescence is of which color?
Green.
Huh?
Fluorescent green.
Green, no, wrong. It's -5. Nucleus of Darkshevich responsible for what? What is the function? Pass. For vertical eye movements. Hand over to Rupa now.
Okay, thank you, team 2. Next question to team 3. Rapid fire questions. First question to team 3. Autoantibody associated with necrotizing myopathy.
HMG-CoA reductase antibody.
Sorry, the correct answer is anti-SRP, signal recognition peptide. So -5. Expand. D-demo.
Pass.
Pass. This is dystonia, dysmorphism, encephalopathy, MRI abnormalities, and no hemiparesis. It's an ATP1A3 associated disorder. Third question. Endure, cherish, and nurture.
Nusinersen.
Clinical trials that tested nusinersen. Very good. 20 points.
20.
Which heavy metal is associated with Caspar-2 mediated Isaac syndrome?
Pass.
Heavy metal. Pass. 0 points there. It's mercury. Mercury.
-5. -5.
No, she passed.
Pass. Okay,
Pass.
sorry, pass.
0.
Sorry. Pass means 0 marks. Yeah.
Team C, your neurosurgery rapid questions coming here. The most common presenting symptom of neonates with vein of Galen malformation is?
Pass.
It's congestive heart failure. Which nerve innervates the dura of diaphragma sella?
Any idea? Should I pass?
Pass. It's the first division of trigeminal nerve. Growing skull fracture occurs most commonly between the ages of 2 and 5 years. This is a true or a false statement?
False.
Correct.
20 marks.
20 marks. Last question. Trigonocephaly results from premature closure of which suture?
Mitopic suture.
Very good. 20 points.
So this round was a +20, right? Scorer. So right, correct answer +20, incorrect -5, and pass 0.
Okay, so team 4, here are your questions for the rapid fire round. First question, name the antibody associated with autoimmune autonomic gangliopathy. Team 4, pass, 0 points. It is the ganglionic acetylcholine receptor antibody. Expand, FCMTE.
I told you, Rupa is the lady of letters.
Yeah.
All the expands.
Everybody gets one expand. Team 4, pass. This is familial cortical myoclonic tremor with epilepsy. Next question. Name the drug associated with the trial Sprint MS. Please note, it's not Sprint, it's Sprint MS. Sprint MS. Team 4, clock is ticking. I think we have to take that as a pass. It is
Pass.
Pass. 0 points. Ibudilast. And last question to team 4. Which is the first relay nucleus for taste-related sensory efferents in the brain?
Nucleus tractus solitaris.
Very good. Correct answer, 20 points.
Team D, rapid questions. Before that, I would like to tell you that Dr. Julius is from Indonesia. Yes, sir. But he's a neurosurgery resident from Indonesia. Welcome. So, your neurosurgery questions starting now. The correct sequence of removal of clamps from the arteries following a carotid endarterectomy procedure is first external carotid, followed by internal carotid and common carotid. This is a true statement or a false statement?
False.
Very good. It's right answer.
20. Yeah.
Please tell the CSF marker for germinoma of the brain. Second question.
Is
Take it as pass.
it should be alpha fetoprotein and
Wrong.
also
That's a wrong answer. -5. Trilateral retinoblastoma describes bilateral ocular retinoblastoma and one more tumor.
in pineal.
Huh?
In pineal region.
I didn't get you.
Pineal.
Pinealo?
Pineal region. Pineal.
What tumor? Pinealo what?
Pineal gland.
What tumor? Of the pineal gland. Just name the tumor.
Maybe melanoma. Should be retinoplasty.
Pinealoma. I think we'll give 10 marks. It's a pinealoblastoma.
Sorry.
10 marks we give. Last question. In the technique of percutaneous radiofrequency trigeminal gangliolysis used it for trigeminal neuralgia, the needle is inserted finally into the
finally into the Meckel cave through oval foramen, usually in the Meckel cave.
You have to give one answer.
Meckel cave.
Meckel's cave. I think we can give that right. Although it's the trigeminal system in the Meckel's cave. I think that's right.
So 20 marks. Wonderful.
Thank you.
So that finishes here. I'll give you 2 minutes time to have the score. Next we have buzzer round. Can you check your buzzer, please? Buzzer is working, Richo? Good. Good. Perfect. So we'll wait now. We'll have a score before you go for the buzzer round. And this is the rules. First team to press the buzzer will get chance. 20 marks for correct answer, but 10 marks for incorrect answer. Till now, it was no negative, then 5 negative. You can see the negative is creeping up. 10 marks for incorrect answer, because buzzer means you are spoiling the chance of others. No delay in answering. Once you press the buzzer, then don't start thinking at that time. And first answer will be taken as a valid answer. Right? Understood everything? Perfect. Score. You have to.
After this round, the team C leads with 155 points, followed by team A with 135 points, team D 85 points, and team B 80 points.
You know, we have organized, thank you. We have organized in a way that you have chance of coming back at each round, because you can see that 20 is not bad, and if you have 5 questions means 100 marks. You lose 10 means you lose a lot. So still you have chance to come back. This will be slightly general knowledge sort of round. So this is a gene editing technique. And the person who discovered it got Nobel Prize only few years back during COVID, 2020. Name the person. Name the person. It should come from you if you just look around. If you don't look around and read book, it won't come. No buzzer from anybody? I am disappointed. Audience. Sorry? None. Nobel Prize 4 years back on this technique, CRISPR-Cas technique. Jennifer Doudna. Jennifer Doudna. All right, we'll move on. Next is name the condition. This has to come out. This has no nobody. Please, not from the audience.
Adults, it feels very unnatural. And it's so tough that the US
A
Marines
Turkish
use it as an
person
endurance exercise.
described this. Patients walk on all four. Neurologist, you have to come forward. Let them see. We have 10 minutes time here. Anybody? No. Audience. Unna-Tann syndrome, right? So somebody pressed after I go. Anyway, so this is 0 marks till now. This is further tough. Again, when you see that questions difficulty, you know that where it came from. This book and movie depicts a neurological condition. Name the condition. The name of the book is The Diving Bell and the Butterfly. Yes.
Sir, Diving Bell and the Butterfly by Gene Bobby, and he had a massive stroke and locked-in syndrome after.
Excellent. I would have given 100 marks for this, but unfortunately I can give only 20 marks. Right? Next question. Again, this is female dominant scientist. You can look around. She is a scientist psychologist. She played a key role in discovery of HD gene. So she almost led the HD collaborative study where she went to South America, collected 5,000 samples of HD because her mother had HD, and she wrote a book, Gene Hunter, Name the Lady. She's a psychologist, but she was credited for the hunting the gene. Name the lady. All right, I think I have to go to audience. Gene Hunter. This is Nancy Wexler. So she is a psychologist. Her mother had Huntington disease. Because of that, she collected a lot of neurologists and she found the gene. So this was the first monogene to be discovered, Nancy Wexler. All right, so this should be easy. Name the actor and the movie. Volume, please.
He's still the same old dad. Surprise!
One more time. It's fun. Name is there. Okay. Anyway.
After half only no.
Huh?
Half only I know. I don't.
So whatever you get, go ahead.
Robin Williams.
Robin Williams. So this is half is correct. And movie?
That is already.
Yeah, okay. Movie is Mrs. Doubtfire. And madam, because she showed the courage, should we give 10 marks to her? I know that negative mark, but should 10 marks. So 10 marks to her. Robin Williams, Mrs. Doubtfire. Why I showed that? Because Robin Williams died of DLBD. This is not came from just for movie. He died of diffuse Leber disease. That's and I think committed suicide. Anyway, moving on. This is slightly tough for neurologists. Academic question. Look at this phenomena. Tell what is happening there. The surface EMG, and what is the diagnosis? I'll give you, say, 20 seconds. It is easy, I can tell you. It's common sense, it's not. Sushanta, you're doing. You have to press first. Yeah, so
this is basically a resting tremor followed by induced in the action tremor. So when basically it is a combination of resting and action postural tremor, rubral tremor.
You're right, but there's a name for that because action tremor is not starting at the same time.
It is re-emergent.
Re-emergent tremor. I think I needed the word 10. What should we give to? 20. Madam says 20. So 20. This classical re-emergence, you can see that postural tremor is not coming initially. There was a flat line and then it started to come again, right? Okay, next question. Very easy. You go to the ITU in the morning, ICU in the morning. You find an old lady lying there. Well, you are told. I'm showing. You're told that the patient has only 2 days history of this movement, and the patient has this MRI. Buzzer should go on. Yeah, team 2.
This is diabetic steatopathy.
Diabetic steatopathy. Wonderful, 20 marks. We can name hemichoria, hyperglycemia, but yeah, you're right. The diabetic steatopathy. All right, should we move on? Identify the abnormality and diagnosis. There's a name for this sign, MRI sign. The appearance. No? It is easy. No? All right. Audience? Arch bridge sign, wonderful. And diagnosis? NMOSD. Yeah, NMOSD. The arch bridge and NMOSD. All right. So if you're not doing well, still don't worry. We still have some questions left. This is for those people who are not doing well. Meanwhile, can you tell the score, please? We'll finish in 5 minutes time.
जब लाइफ हो आउट ऑफ कंट्रोल होठों को करके गोल होठों को करके गोल सीटी बजा के बोल जब लाइफ हो आउट ऑफ कंट्रोल होठों को करके गोल होठों को करके गोल सीटी बजा के बोल
All right, so all is well, right? So next round is few questions, I can tell you. Sir, we are finishing 5 minutes time. Is that okay? Okay. The round is Armageddon round. This is final war. Armageddon is a mythical area where final war was fought. 24 right answer and 24 wrong answer. Can you imagine? Right, but issue is that it will go to team 1 first. You have to decide whether you want to play or not. If you don't want to play, fine, you are happy with the 0. If you want to take risk, you can go for 20. Should we do 30 for this? Let's do 30 for this. So 30 for right answer and 20 for wrong answer. And pass they can do 0 marks. All right? This is not buzzer. We'll go for 1 by 1. Are you ready? Team 1. So first thing is that whether you want to play or not. That's more important. Because once you commit for playing, that means you have to play.
So we commit after seeing the question?
No, not at all. After seeing the question, no. You have to commit right now. Yes or no? खेलो ना क्या करना यार चलो he will play. So okay. Ready? Use your common sense. I'm not foolish to put the same picture again. His name is Alim Benabid, right? He discovered DBS in Grenoble, France. When he did MBBS and neurosurgery, then he thought that something is lacking and he went to do PhD. How many of us can take this, have courage? After getting through medicine degree, Professor Alim Louis Benabid did PhD in what subject? Man, you are losing 20 marks. Think of something. If you don't say, still you're in minus 20, I can tell you. You have to say something. Minus 20, yes, you have to say something because you already committed. कुछ तो बोलो ना.
Psychology.
Psychology is wrong answer because he didn't physics. So he did physics. He went back to, so you thought about that, right? After being neurosurgery, because he wanted to do some brain manipulation, he went to do PhD in physics and then he discovered DBS. So that was physics. Team 2, minus 20. Team 2, game खेलना है नहीं खेलना है?
Sir, is this the scientist game or like?
What is
मतलब this?
ये पहले ही पूछ रहा है कि क्या है क्वेश्चन नेचर क्या है क्वेश्चन नेचर क्या है ये शेयर मार्केट में अच्छा करता होगा ये I will tell, but it's not that tough, I can tell you. It's a 50-50. I won't tell you. 30-20. Yes?
We will not play. Scientist.
Himmat kar.
Sir, if it's a
if you don't,
if it is a non-scientist question, then we will play.
I won't tell you. I won't tell you. I won't tell you. All right. So pass. तुमसे उम्मीद नहीं थी यार, तुम तो अच्छा लिख रहे थे. चलो ठीक है. So the question goes to team 3. अच्छा, let's do one thing. This will be audience question, because team to audience question and audience prize question. If somebody tells properly, the audience prize question. I was told by Rishu that prize question you have to tell beforehand. So audience prize question. Ready? 5 minutes. Yeah, it will done. Can you see this model? Look at the model first of all. Right? This is DNA model. Somebody is Watson, somebody is Crick. Who is Watson here? Khada. The sitting one or standing?
Standing one.
Unfortunately, no. He was Francis Crick, who was an older person. Watson went to Cambridge. He was a younger person. So sitting is Watson. Watson always sits, by the way. Right? So no prize for this issue, unfortunately. Chalo. Now team 3. खेलोगे? खेलना है? क्या करते हो यार? Are you topper now? Topper लोग risk नहीं लेते हैं. All right. Again, it will go to audience. This audience prize again. Rishu? Audience prize. So one you got, no prize, right? Game or dare. He has done monumental work in Parkinson's arena. Name the person. Clue is that look at his hand. He's holding something. He's holding Nobel Prize. Only one person in Parkinson's arena has got Nobel Prize, I can tell you. Only one person. This is not Louis Benabit, by the way. The person who described that dopamine deficiency is the reason for Parkinson's disease. And you can imagine that everything happened after that. Yes, sir? Awakening movie. Uska naam hai usme. Wonderful. He gets the prize. Arvind Carson. Jaake naam le lo prize. I'm so happy I got it. I was getting frustrated. All right. So next question, team 4. You'll play? Play, man. Play. Kya karna hai? Hello, topper. Come on. You have to play. I'm telling that you have to play, right? Yeah. So of course. So this is tough question. History was made. I can tell you. Let's see the video first.
I felt that the moment of a lifetime had come.
I know that. I know you're a runner, so I know that. Team 4, first of all. No.
Those last few seconds.
Team 4 has already committed, so it won't go to audience, but this is easy question.
Stood ahead as a haven of peace after
This Sarana is a neurologist from London. Name the neurologist.
Taking his last spring to save himself from the chasm that threatens to engulf him.
Okay.
My effort was over.
Has to come from audience. Can we give a prize for that? Wonderful. Roger Bannister. So Roger Bannister was a neurologist for the first time. So you can imagine that he was top neurologist. He wrote books also. And he was the first person who broke that 4-minute mile barrier. And this was exactly happening in Oxford. So this he was running 1 mile within 4 minutes and the first human being to do that. So Roger Bannister, if he track. Prize dena isme? Who was the first responder? Chalo, theek hai. Rishu? So you have 3 prizes gone, right? So all done, but one more question if anybody wants to take that dare. And this time 40 marks for correct and 30 marks to be taken off for the incorrect answer.
You want to take
Yeah, minus 20, unfortunately, yeah. Mere karan hua, but sorry. Yeah, so, ready? Anybody?
Sir, can you display the question then?
I cannot display the question. Oh, yeah, buzzer mark. Chalo karta hu, theek. All right. So, one, push the buzzer. If you don't tell, minus 30. If you tell wrong, minus 30. If you're correct, then plus 40. Ready? This is a buzzer round.
So how many questions?
How many questions?
Only one question. This is the last question, by the way. Identify the condition and antibody that can be associated. Just relax. Just relax. Identify the condition and antibody that can be associated. Right? This is a question given by Jackie. ये बच्चे लोग इतना tough question देते हैं ना. After, who is that? Team 4.
Anti-Cavin antibody.
Sorry?
Anti-Cavin antibody.
जोर से बोलो.
Anti-Cavin antibody, sir. Rippling muscle.
क्या बोली? Yeah, perfect. So antibody is wonderful. And name the condition. Condition.
Rippling muscle disease, sir.
Excellent. That was wonderful. I'm very happy to hear that. So 40 marks for team 4. 40 marks for team 4. That's wonderful. And last question for the audience. What is the movement? What is the movement? This is mirror movement. Well described. Mirror movement. You can see no step is my misstep. And this is mirror S2TP. And that ends the Star Wars. Thank you very much for participation. We had a wonderful time. Thank you on the behalf of all the quiz masters and madam. Thank you.
Okay, that's great for you on the MacBook. Actually, very smart choice. Last one, not to play, but you knew the answer.
So the plan is that audience prize will be given here. And the final result, I was told that we should tell on the stage with all the prizes. So unfortunately, you have to come, all 4 of team have to come there to know the result. We're not giving the result. Yeah, audience team, bata do na.
No, when are they going to tell the results? Tomorrow? I'll take a picture. Really?
So the audience prizes are to Dr. Paras Gangwal, Dr. Apoor Sharma, Dr. Apoor Sharma, Dr. Neha Pandita.
Oh yeah. So, all right. So what happened that they told that prize question was later, but if you have prize, please give. Yeah, please come over, sir. Please come over, sir. It's good to see that you fight for your hak. Thank you very much. Thank you. Thank you. Very nice. Thank you.